Hello, folks. Thank you for joining me for some understanding of psychological trauma. My name is Dr. Parker Wilson. I'm a clinical psychologist. I specialize in trauma and traumatology. And we're going to talk first a little bit about what PTSD is. It's basically a glitch in the fight, flight, or freeze mechanism of our central nervous system. Standard PTSD usually comes from a one-off event, like a bad car accident, a natural disaster rather, and something like 9/11, victim of a crime, somebody puts a gun in your face, a situation where you thought you were going to die. Typically, it's a one-off. Complex post-traumatic stress disorder is a little bit different. It's harder to treat, usually because it comes from a more seriously wounded place across developmental years, where people are really forming their personalities. Usually it's like trauma caused in childhood or adolescence that really drags on and has a hard time responding to the standard treatments for PTSD, so it had to be a little bit more escalated with complex PTSD. There's two basic kinds of trauma. There's acute, the one-off, like I said, and developmental trauma is the more serious one. It's where somebody in your family has sexually molested you for years on end. You've been bullied very brutally in school for months or years. The reason this is a more serious trauma to deal with is simply because, say, with somebody who puts a gun in your face and they mug you, you weren't necessarily expecting them to be a nice person. You didn't have any expectations of them necessarily. But when you're a little kid and the person who's traumatizing you is mom or dad or brother or sister or someone else who has some relation to you and is supposed to be looking after you and taking care of you and watching out for you, and instead they're the one traumatizing you and traumatizing you at a time when your personality is forming. Say, as compared to a 22-year-old military vet who's on his third tour in Fallujah and gets PTSD behind a firefight. He's otherwise non-traumatized, comes from a non-traumatized childhood or adolescence. That's much easier to treat than developmental trauma. Developmental trauma is typically much more difficult to treat. Treatment for trauma, begin the process by determining a valid diagnosis. So we go through the symptoms. We talk through the person's experience. We'll typically do a life chart for our patients, so we'll go through every year of their lives and determine what's happened in a major way, good, bad, and neutral. Once we have a diagnosis that the patient agrees with, which again is very important, then treatment moves into building awareness around the symptoms, the severity of the symptoms, and how to counteract them. Essentially, PTSD and CPTSD are issues of emotion regulation, dysregulation in particular. And so the primary treatment for that is cognitive therapy and meditative exercises that establish better regulation and emotional balance. Any numbing out of one's feelings with drugs or alcohol, which is pretty typical with trauma, has to stop or be otherwise totally minimized. It's important to start to feel what you're feeling instead of avoiding it. Treatment often feels risky. It feels like you're moving in the wrong direction. It feels counterintuitive. When you feel afraid, you want to move away from something. But when you're dealing with anxiety, and it's pathological anxiety, so you're on post-traumatic stress, you want to move into the anxiety. You want to make friends with it. You want to understand it. And to do that, you have to take a risk, and it feels like taking a risk at times. So how do we get out of feelings that we don't like, including anxiety? But it can also be frustration, stress, fear, sadness, loneliness, loss, depression, shame. Anyone can add to this list. We have these set of emotions, say the ones I just named, and we typically label them as bad. And we typically think of ourselves as we shouldn't be feeling these things, and these emotions are bad. And since we're judging ourselves and our emotions as being so negative, we want to get out of it. And the easiest way to get out of it is to drink some alcohol or snort something or binge a Netflix series or have sex or get into workaholism or romance novels or play too many video games. You can numb out with anything, food, etc., etc., etc. The next big exit door is anger and aggression. I'm just going to take what I'm feeling, like, say, anxiety or dissatisfaction, and I'm going to project that onto you. I'm going to blame you for it. Now you're the source of my dissatisfaction. Are you following me? And since you're the source of my dissatisfaction, I can blame you for how I'm feeling. And once I can blame you, I can get angry at you and sustain it. I have an object of blame now. So this anger and aggression exit door can be very overt, yelling, screaming, hitting, assaulting people. It can be very subtle too, passive aggressive, getting weepy, walking out of the room, hoping somebody follows you, this kind of thing. The last big exit door that we take out of what we feel, out of our experience of life, the last big way we get out of experiencing our own life is materialism. When we're very good at this in America in particular. We love retail therapy. We love to buy a bunch of extraneous crap we don't really need. As long as it's shiny and pretty, it's going to make me feel better for a little bit. In a transitory way, it's pretty much like a drug. And we even get materialistic about people too. Like I blame my wife for why I'm feeling so dissatisfied or why I'm feeling so lonely or so stressed out. So maybe I need a new model of wife, right? Maybe I just upgrade my model of wife. So we start to get materialistic about human beings as well, which is bad. This is a little equation in clinical psychology, S equals P times R. Suffering equals pain times resistance. Pain, the P in this equation, is referring to the pain inherent in life. In Buddhist terms, this is birth, aging, sickness, death, being met with unfortunate circumstances you don't want that are beyond your control, being separated from people, places, and things that you do want, and that separation is beyond your control, and the fact that everything isn't permanent. These are the typical sufferings that Buddhists point to. There are a few more, but I won't get into them in this video. No one likes to age. We're very uncomfortable with aging. If you ask the little kids how old they are, they'll typically go 4.5 or 5 3/4, not just 4 or 5. Teenagers do that too. It's not that I'm 15 and a half, it's that I'll be 16 in 2 weeks, right? That's the whole thing. It's not that I'm 15, I'll be 16 in 2 weeks. We all get comfortable with our age around our 20s. No one has too much problem with that. Usually around 30, some people start to freak out. Around 40, a lot of people start to freak out. Around 50, some people start to freak out. But now the freak out is about it's being too old, not too young, right? Now I feel like I'm too old. I'm too old. I'm not young enough. Whereas before the problem was I'm too young. I'm not old enough. You know, I'm not 5.5. I'm going to be 6 soon, you know? We just don't like aging. You got sickness, everything ranging from colds and flus to leukemia and AIDS. You've got death, which is the ultimate uncertainty that we all have to live with. Most of us deal with that uncertainty by simply ignoring it or telling ourselves making up some story how death won't affect us or come for us until we're ready, some kind of nonsense like that. In actuality, death comes at any time, is no respecter of life, is no respecter of age, is no respecter of gender or culture. It can and will come at some point, and you won't be ready for it, and neither will I. Yeah? So these are all the pains inherent in life. Have you ever fallen in love with someone and they didn't love you anymore? You lost a job that you really liked. They couldn't afford to keep you anymore. We got a lot of people in this country who are immigrants who have entire families across oceans that they haven't seen for years. They remain separated from their loved ones. All of these are the standard universal sufferings inherent in human life, for the most part. Okay. So to the extent that we resist that, to the extent that we say that that's not true, to the extent that we create fantasies and stories and narratives that get us out of how we feel, like I'm scared about death, or I'm anxious about sickness, or I'm anxious about aging, and I just want to deny it, and I want to get out of it, and I want to minimize it, and I want to justify it, I want to rationalize it, I want to blame other people for how I'm feeling. To the extent that we resist, we create suffering, geometrically speaking. So to the extent that we resist this, we actually create so much more suffering than the pain would ever have given us. So how much I suffer is a function of the pain inherent in my life, multiplied by all the ways I resist experiencing that pain, numbing out with booze and drugs, materialism, etc. So theoretically, if I bring down my resistance level to a fraction, say a half, I will actually cut the pain in half. So I'll actually cut the suffering in half. Okay? I've accepted it. I've accepted it in the deepest possible way, which is why Buddhists meditate on birth, aging, sickness, death, etc. on a daily basis, to decondition ourselves, to start to bring down our reactivity and our resistance to the pain that is inherent in life. When we do that, we see we have much more emotional control. We have much more happiness. We thrive more. Far less suffering. We're not at war with ourselves. We're not at war with the reality around us. We're in sync with it. I hope that makes sense. And then, core meditations for post-traumatic stress disorder. The first one, the Sanskrit name is called shamatha. It means calm abiding or single point of focus. It is the initial and original meditation the historical Buddha taught. It is the foundational meditation. He taught it first for a reason. The reason is because it creates mental and physical relaxation and stability and vividness. It creates concentration. It creates mindfulness, if you will. Although the Western understanding of mindfulness is a bit simplistic, it creates mindfulness. It has two stages, settling the body in its natural state and settling the speech, both of which, if you're a patient and you're in my practice, you'll be instructed extensively in. There's a technique called Tonglen, which is emotional alchemy. It's translated as giving and receiving. Very, very powerful weapon against trauma and depression, mood and anxiety disorders. And then you have Maitri, which is loving kindness, unconditional friendliness meditation. There are more meditations in addition to these. In fact, we'll customize a meditation program for you in addition to the talk and cognitive therapies.